Great. Good afternoon. The webinar will begin shortly. It'll be a few minutes until we get started while we wait for attendees to join. Thank you for your patience. Thank you. If you are just now joining us, we'll get started in a minute. We're just waiting for everyone to log on to the platform. It just takes a minute or two. Hi, everyone. If you're just now joining us, thank you. We appreciate you being here. Just give us a minute or two and we'll get started. We're just waiting for everyone to join. It just takes a couple minutes. All right, I think we have most everyone loaded on. So thank you again for joining us today. And good afternoon. My name is Jamie Moore, and I'm a practice management advisor at the Florida Bar. I welcome you to today's webinar, Culture, Context, and Critical Hope, Considerations for Attorney Mental Wellbeing. I want to thank the Standing Committee on Mental Health and Wellness of Florida Lawyers, especially the Education Subcommittee, for organizing the program today. During the webinar, if you have a question for the presenter, please post it in the question and answer section at the bottom of the screen. Some of the questions will be answered by the presenter at the end of the presentation. Due to time constraints, there may not be time to answer all questions. At the end of the webinar, I will provide everyone with the course number, which you will use to self-report in your member portal. And now for a brief disclaimer. CLE presentations are intended for educational purposes only and do not replace professional judgment. Statements of fact and opinions expressed are those of the presenters individually, and unless expressly stated to the contrary, are not the opinion of the Florida Bar or its committees. The Florida Bar does not endorse or approve and assumes no responsibility for the content, accuracy, or completeness of the information presented. Any feedback should be provided to the event organizer. If you have any questions, you can email legalfuel@floridabar.org. Again, that is legalfuel@floridabar.org. At this time, it is my privilege to introduce Dr. Sarah Vinson, our presenter for today's webinar. Dr. Sarah Vinson is a triple board certified physician who specializes in adult, child, and adolescent and forensic psychiatry. After graduating from medical school at the University of Florida with research honors and as an inductee in the Chapman Humanism Honor Society, she completed her general psychiatry training at Cambridge Health Alliance Harvard Medical School. While there, she also received specialized training in trauma through the Victims of Violence program. She then returned to the South to complete fellowships in both child and adolescent and forensic psychiatry at Emory University School of Medicine. Dr. Vinson is the founder of the L'Oreal Psych Group, an Atlanta, Georgia-based mental health practice providing expert care and consultation. With her breadth and depth of training, Dr. Vinson serves a variety of clients with whom she works on issues such as depression, anxiety, ADHD, and oppositional behaviors, bipolar disorder, school disciplinary issues, post-traumatic stress disorder, and autism spectrum disorders. Thank you, Dr. Vinson, for presenting today, and I will now turn it over to you.
Hello, I'm really pleased to join you all today and talk about these really important topics. There will be the opportunity to ask questions throughout, and the moderators will ping me if something comes up, because I want this to be as interactive as possible. I know it's lunchtime on a Monday and on Zoom, and so the more that I can get from you feedback-wise, the more applicable I can make these comments to you. So I'm going to share my screen now. So culture, context, and critical whole considerations for attorney mental well-being. So what's ahead? We'll talk a bit about the mental health to illness continuum, spend some time on culture and context, discuss burnout and secondary traumatic stress, have some discussion about attorneys specifically in occupational risk, thoughts about mitigating risk and promoting health, and then systems change and self-care, followed by our discussion. But certainly if you have comments or questions throughout, it's not an interruption, it is a valuable contribution to the content. So some ground rules, and this would be more applicable if we had more of a discussion, but of course, we want people to feel safe, bringing up their comments, asking their questions. And so just making it a respectful environment, being mindful of different perspectives that people may have and realizing that different is not always bad or wrong. That this is a bi-directional interchange, hopefully, and that I really do want input from you all throughout. So I know you're busy. I know there are lots of things you could be doing right now. If your email box looks anything like anything like mine's, it may be a bit anxiety provoking for you. And we're on a screen. So I know that there can be the temptation to try to multitask or to do other things here versus just sitting back and listening. And so I'll just make a plug for giving yourself, not me, these next 60 minutes to really devote your time to thinking about what this topic means for you. Emails will be there, to-do lists are living documents. Multitasking isn't a real thing. Trust me, I'm a doctor. And if you only work 40 hours a week, and I'm guessing many of you work more, this hour is 3.25% of your work week. So give it to yourself. So before we get started into the formal content, right, I just want to acknowledge that there is so much that has happened societally. There are so many layers to mental well-being that it always happens in the context of society and your standing in society, how you identify, issues of intersectionality are at play, of course, as well. And so there are a lot of things that I won't be able to go into as it relates to this topic that may be very important to you. And that's just for the sake of time because it's very multi-layered, and I think it's important to acknowledge that. And then just thinking about, where society is right now, some of the things that are front and center, and what that means for society as a whole, and the questions we're asking about our mental well-being and the stress that we are experiencing collectively. But also the unique role that your profession is playing in trying to mitigate or trying to navigate some of these issues. And when it comes to attorneys, this is a group that has a lot of traumatic exposures. And in fact, 2 studies have found that lawyers showed more symptoms of indirect trauma than mental health professionals. And I'll tell you, as a forensic psychiatrist, I am in clinical settings where I'm reviewing, medical records and patient charts. And then at other times, I am reviewing case files and I'm seeing people in prison and I'm seeing a very broken 20 or 30 or 40 something year old person, but able to look back and see all of the ways that all of these systems have failed in their entire life. And the level of immersion that you have with some of these cases is different than you might experience in clinic. And what you're able to do to help may be different or feel different. And so while this, that these studies found this was a bit surprising to me when I compared and contrasted the work settings, the emphasis that they may put on making sure you have your own therapy and that being part of your training, which is the case for mental health professionals, whereas it's not necessarily the case for attorneys. Maybe it wasn't so surprising after all. But I think it does highlight that this topic is one that should not be a one-off for you in a CLE course, but one that is kept front and center throughout the year and frankly throughout your career, because there is a certain occupational risk from your job related to trauma, which has significant implications for mental well-being. So let's go back to this mental health idea and ask the question, how do you define or how do you think about mental health? This really strange thing happens in medicine and in mental health care is that we say health, but a lot of times we're focused on illness. We're talking about depression, anxiety, substance use disorder, suicidality. A lot of our mental health discussion centers around illness and symptoms and impairment. We talk a whole lot less about what the ideal actually is. Well, this is a definition from the World Health Organization, and it says a state of well-being in which every individual realizes his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to her or his community. And so what I like about this definition is that it really highlights that it's not just about the absence of illness, right? You can be someone who doesn't meet criteria for major depressive disorder or bipolar disorder or alcoholism, but that doesn't necessarily mean you're mentally healthy. Being mentally healthy entails these things that are based in relationship, that are based in adaptive coping, that are based in productivity, and that really highlight relationships. And so this thing we do, right, in medicine and mental health, where we're like, well, you have an illness or you don't. You meet criteria or you don't. You have this diagnosis or you don't. Doesn't really fit with how people actually operate and doesn't really fit with the continuum between mental health and mental illness, which is a much more person-centered way to think about it. And so everyone is on a continuum between mental illness and mental health. And everyone can move at various times based on stressors that they are experiencing and the protective factors, supports, and adaptive coping they have versus the risk factors and maladaptive coping that they may be employing. And we saw this continuum play out on a broad scale during COVID, right? The entire society was stressed out for various reasons at different levels. And what the CDC came out with, to no one's surprise, was that rates of depression, anxiety, substance use all increased during that time. Well, the stress went up, the opportunities for adaptive coping went down, and people started to turn to maladaptive coping. And so what we saw was a population shift toward mental illness. It wasn't that all of a sudden those folks' genetics or biology changed, right? But it's that the social factors ended up pushing people along this continuum and pushing people who may have been vulnerable or maybe already there. And I'll tell you, as a mental health professional during that time, I certainly saw that in my practice, that folks who had been steady and didn't quite need me anymore ended up coming back. We were getting more calls than ever before. And so what I hope that you will hold on to as you consider this continuum is that even if you think you're okay, even if you go to your PCP and they give you a depression screen and it doesn't flag you for anything, there could be things that you could put in place or things that you could protect or things that it's really important for you to continue that are pushing you further on that continuum toward health and that are helping to preserve your health. So we think about the culture of law and mental health, right? It's one that can be particularly challenging. We talk quite a bit about cultural competency when it comes to working with clients. I know that you do that in the legal field, we do that in the medical field, but often those discussions of culture don't take into account or explicitly acknowledge the culture of our professions, right? So law is a culture that is very hierarchical, has individualistic framing. The isms that we see in the broader society play out in this system as well. There may be financial imperatives or financial constraints, and these adversarial dynamics. So all of these things can make an environment more stressful, right? They also may play into what avenues you have available to you to try to mitigate some of the stressors that you're dealing with or confronted with, or that your clients are dealing with and are confronted with. And so there's this concept of critical hope that I was introduced to a few years ago. It has more airplay, so to speak, in educational literature. But in thinking about how we take on careers that are hard and that ask thorny questions about society, and that can be very high stakes at times, I think this idea of critical hope has some real value. And so this is borrowed from service learning literature. And it's an educational approach where a student learns theories in the classroom and at the same time volunteers with an agency, usually a nonprofit or a social service group, and engages in reflection activities to deepen their understanding of what is being taught. And so with critical hope, you're understanding that this educational process isn't always going to be comfortable. And there's the intentional embrace of emotional elements, including tension, ambiguity, and discomfort. And it's not naive hope or blind faith. It's not hokey hope based on the bootstraps narrative. It's not mythical hope based on the false narrative of equal opportunity, emptied of its historical and political contingencies. And it's not hope deferred or critique without engagement. But to say someone is critically hopeful means that the person is involved in a critical analysis of power relations and how they constitute one's emotional ways of being in the world while attempting to construct imaginatively and materially a different life world. And so when you're dealing with these high stakes cases, or maybe it's not so high stakes, but maybe it's the volume of them. Maybe it's the interplay between what's being asked of you at work and what's being asked of you at home. It can be hard to take on some of these bigger issues and they can feel overwhelming. And so critical hope acknowledges that it is hard work, but also calls upon us to continue to engage, guided by the ideals that inspired us to do this work in the first place. So next we'll talk a bit about burnout and secondary traumatic stress. So in this discussion of burnout and secondary traumatic stress, I would ask you to consider what is pushing you toward or away from mental health. And again, asking you to step out of the framework of, well, I don't think I have a major depressive disorder, or I'm not bipolar, or I don't have a substance use disorder. But what, just broadly speaking, is helping you be more healthy or making it harder for that to happen. So there are some instruments to help look at burnout and secondary traumatic stress. And these are the three categories that one of the most commonly used ones has. So compassion satisfaction. Compassion satisfaction is about the pleasure you derive from being able to do your work well. For example, you may feel like it is a pleasure to help others through your work. You may feel positively about your colleagues or your ability to contribute to the work setting, or even the greater good of society. And of course, that's where we'd always like to be. Burnout, and this is something that most people have an intuitive idea of, but from the research perspective, burnout is one of the elements of compassion fatigue. It is associated with feelings of hopelessness and difficulties in dealing with work or in doing your job effectively. These negative feelings usually have a gradual onset, and they can reflect the feeling that your efforts make no difference, or they can be associated with a very high workload or a non-supportive work environment. And the third one is secondary traumatic stress. And so if you think about secondary traumatic stress as kind of a cousin of PTSD, that can be a helpful framework for it. So it is about your work-related secondary exposure to extremely or traumatically stressful events. If you are exposed to other traumatic events as a result of your work, such as providing care to people who have sustained emotional or physical injuries, this is secondary exposure. And certainly one example would be having to be intimately knowledgeable of violent acts, of aggressive acts, of graphic pictures, of documentation of trauma, all of that would count as well. The symptoms of STS are usually rapid in onset and associated with a particular event. They may include being afraid, having difficulty sleeping, having images of the upsetting event pop into your mind, or avoiding things that remind you of the event. So secondary traumatic stress, when it's present, can impact how you think. So you may have lowered concentration, apathy, rigid thinking, perfectionism, or preoccupation with a distressing or horrifying event. So when you're trying to focus on something else or get something else done or shift gears and go to another case, you have a hard time leaving that one behind. It can also affect how you feel. So there may be guilt, so irrational guilt, and ownership for outcomes that aren't quite fair to you or accurate, anger, numbness, sadness, or helplessness. And when it comes to trauma reactions, including STS, one of the things that can be confusing about them is how disparate their responses can be. So some people are going to externalize more. Some people are going to be more outwardly upset, whereas some folks will be much more withdrawn. It can also impact how you operate. So withdrawal, sleep problems, appetite changes, and that appetite could go up or it could go down. Hypervigilance, so being jumpy, feeling on edge, and an elevated startle response. And it can also have implications for how your body functions. And so the brain is an organ, and it is the commander of all of the other bodily functions. And there's a way that when we are stressed mentally, it comes out physically. And sometimes when we're not aware of it cognitively, our body can still keep the score, so to speak. And so there may be things like increased heart rate, difficulty breathing, muscle and joint pain, impaired ability to fight illness, and the worsening of extant medical problems. And even things like glucose intolerance are tied to elevated stress levels over a prolonged period of time. And with STS, there is an increased risk for things like substance use disorder, depression, anxiety, relationship conflict, and even impaired work performance. Now, I will say that for high functioning type A folks, the kinds that tend to end up as attorneys, sometimes work performance will be the last thing to go, because work performance is something that you take a great deal of pride in, and it's part of your identity. And so sometimes other aspects of your life will take that hit and absorb that hit while work performance is preserved until the end. And so with burnout, you have physical, emotional, or mental exhaustion accompanied by decreased motivation, lower performance, and negative attitudes towards oneself and others. So whereas STS may be more of an acute onset, where you can identify this is the case that really made this difficult, with burnout, often it's something that's happened over time. It's been carrying an increased workload or an unreasonable workload over time, and it just builds. Symptoms are things like fatigue, apathy, you may get headaches, and that can have diet and sleep changes as well. One of the things one of my mentors, Dr. Alpha Stewart, says is it burnout or is it arson? Pointing to the fact that sometimes we take upon ourselves that we need to cope better or do more things to cope or manage better, when really the situation is one where the environment is the driver and the environment is what is ultimately going to have to change. Edward Deming said a bad system will beat a good person every time. And so sometimes it's a situation where the work environment itself, it's not necessarily a particular case. The work environment itself is toxic. And the solution there is that there has to be a change in the work environment, because you can't out-cope your way out of something that is actively and continuously harming your mental health. So another question is it burnout or is it depression? And so you can have overlapping symptoms of the two. So if we go back to the slide that talks about fatigue, that can be a symptom of depression. Apathy, decreased interest, we call it anhedonia when we're using a mental health term for it. Can also be a symptom of depression. Somatic symptoms are symptoms, diet and sleep changes are as well. And so there's a ton of overlap in those symptoms. And in some settings, it's more socially acceptable to say I'm burned out than it is to say I'm depressed. And so it's important to be on the lookout for the potential that what is being labeled burnout could be depression instead. And if it's depression instead, then you really want to not only do those lifestyle interventions, which are important whether it's depression or burnout, but it would be important to talk to a primary care provider, a therapist, a psychiatrist, someone who can really assess the situation and let you know what all of your different opportunities are for treatment or for intervention. Next, we'll go to looking at this from the perspective of the courtroom. And so, this is where you go to work, perhaps if you are a trial attorney in trying cases. And so I think in considering this topic and considering environment, it's worth spending a little bit of time thinking about just that setting. So people are wired for connection, right? And we know that if we watch how people do over time, when they have relationships where they can have candid disclosures, where they feel heard, where they feel validated, where what they're saying is reflected back to them, that is something that is protective for people. When you're an attorney, though, right, there's a way that society holds you to a different standard, that your peers may hold you to a different standard. And there are very real concerns about how candor may be interpreted, right? If you have a depressive disorder or bipolar or anxiety, how do your peers look at you? How does the bar look at your level of fitness? And are there ways that having a mental health diagnosis or even engaging in mental health services starts to challenge your sense of self and how you like to see yourself? And then there's just the baseline stress, right? Even under the best circumstances, your job carries a degree of stress that most people simply do not. When a bad day for you can impact another human being's liberty, their citizenship, their life or death, whether people are made whole, whether the right call is made about children's well-being and family bonds, that is a tremendous amount of pressure to operate under day in, day out. And as people who are doing it all the time, you may not take a step back and just consider it, but for a lot of folks, for most folks, the stakes simply are not this high all the time. And knowing that you're dealing with these kinds of stakes can most certainly play into workplace stress and burnout. And then just thinking about the kinds of folks who end up in these systems, who ends up with advanced degrees, that they tend to be very high functioning people who are go-getters, who have that type A personality or have learned to at least channel some type A personality to get through schooling and to be a practicing member of the profession, right? And there's a thin line, right, between the pursuit of excellence and perfectionism, constructive criticism and demoralizing dialogue, between an internal locus of control, so believing that what I'm going to do will make a difference in what the ultimate outcome is, versus owning things and taking responsibility for things that in reality you really did not have control over. Utilization of intellect versus reliance on rationalization. So I see this with my, high achieving private practice clients, that they're so used to being able to think their way through things. When it comes to things that are more emotionally driven or that have to do with their own shortcomings or just human frailties, it can be more difficult because they want to rationalize their way out of it or kind of compartmentalize what they're going through. And then for reaching for goals versus overextending, right? So when you've been that person who's at the top, when you've been the winner, when you've been the high achiever, what it means to say, I can't do that. or I can't take that on, or I can't take that on right now. And that being something that's harder for people who are highly successful. So I did want to just note alcoholism and its substance use disorder, alcohol use disorder, technically using medical verbiage at this point. And I wanted to highlight it because it is something that has been noted in attorneys to occur at higher rates than the general population. So a 2016 Journal of Addiction Medicine study found that 1 out of 5 lawyers engaged in drinking at a hazardous level. And it also found that 28% had signs of depression and 19% had anxiety, with these concerns more common in those with hazardous alcohol use. And by hazardous alcohol use, we're talking about more than 2 or 3 times a week. We're talking about situations where it's causing conflict, and it doesn't have to be, drunk driving. It could be arguments with people in your life when you're intoxicated. It could be people in your life who are raising red flags about the level of alcohol that's being used. It could be that you have health conditions that are worsened by alcohol use and you continue using. And it can be hard, right, when alcohol and bonding over alcohol is part of the culture of a profession, when this is an issue. But just something that I wanted you all to be mindful of and to ping for you. Certainly during COVID, we saw the use of alcohol go up in society as a whole. And so it's something to be mindful of and to watch, both in yourselves, but also in your colleagues. So substance use versus substance use disorder. So just because you use alcohol doesn't mean you have a substance use disorder. So what is the difference? If you're finding yourself having to use more alcohol to get the same effect over time, then that is a sign that your body is getting used to alcohol and that there is a physical dependence that could be developing. If there's any use in hazardous situations or in situations that are actually actively harming you, or if it is actually having a negative impact on you psychologically. Is it messing up your sleep? Is it making it harder for you to concentrate? Things of that nature. And then, of course, there's what happens at work. There's what happens at home. You're bridging those two places. And certainly what happens in one setting can influence what happens in the next. And so when we consider at home, right, a lot of us are wearing a lot of different flags. We're juggling a lot of things. And those demands at different times may mean that at work we have to cut back more. But you may not always feel as if you have the luxury or the space to do that. The members of the household, how they're doing, what their needs are, of course, that can fluctuate over time as well. But sometimes it can feel as if everything's coming in on folks all at once. And so getting help in the home, getting support in the home, thinking broadly about areas of helpers, right? Whether this is home organizers or house cleaners or respite for the kids, these are all things that can be components of mental health as well. So how do you support your team? So there are policy and practice implications in the workplace that we know can be helpful for promoting mental health in the work environment. If you have people who are part of the team who are members of minoritized groups, and they are maybe an N of one or just a few among your numbers, it's going to be really important that you promote and support their ability to be in validating, safe environments where that identity is not minoritized and where they can get feedback, they can bounce things off of folks, they can make connections with other folks who share those identities. And so employee resource groups, conference support that allow them to go to conferences where they may be able to meet more people who share their identity, both as an attorney and as a member of that minoritized group, are going to be really important. We know that we have a youth mental health crisis in this country right now. And when employers are asking employees about stressors, youth mental health is actually starting to bubble up. And so practical supports for parents is something that could also be beneficial. When you're considering mental health coverage in your insurance plans, trying to look for network adequacy, you would be surprised that in some cases, private insurance has poorer networks than public insurance like Medicaid. So you do really have to be diligent about asking questions about therapists, psychiatrists that are in the area that take that insurance and that have open panels. And then of course, EAP programs as well. Respecting boundaries. So if someone tells you they can't do something, if someone is expected not to work on weekends, if someone communicates something, being mindful of the power differential that you have as a manager or a leader, and doing your best to respect that. And even something as simple as if the expectation is not that people are responding to emails on weekends, setting your email to go out at 7 a.m. on Monday, right? So that they don't have the pressure of, well, this is what it says about responding, but I'm getting this email now, what do I do? And then setting examples, right? It's one thing to say that this company values your well-being and values the fact that you need time off. Is one thing to say, I, as your manager, think that's important. It's another thing for you to do it, right? For you to demonstrate kind of self-care for your own self. And then when you're considering how people are doing in the work environment or trying to get a sense of how prevalent these issues are, to the extent that it's possible, getting stratified data for historically and currently marginalized populations. And the reason for that is because given the need for validation, given the need for belonging, given the need for connection, and given the stress that comes with being part of a marginalized group, it could be that if you're looking at data that lumps everyone together, differential impacts of stressors or inequities in the level of burnout and STS that people are experiencing may go unrecognized. And if it goes unrecognized, it will most certainly go unaddressed if you're trying to think about structural or policy responses to it. And then on supporting yourself and your staff, these are things that have been shown to be helpful and that are absolutely within your control, even if you're in a situation where your budget is being cut or society is more polarized than ever, or we're worried about what we're thinking about on the world stage. There are things that you can do to help protect your team. So being honest and transparent, expressing gratitude and doing that in a specific way that acknowledges the person and what you're expressing that gratitude for, giving authentic feedback in a caring way, and actually, having fun and inviting others to have fun as well. So going back to this check-in, right, of what's pushing you toward or away from mental health. And if there were things in those discussions of STS, of burnout, of alcohol use disorder, that seemed to hit home for you or that maybe seemed a little familiar, I hope that you'll take some time to further explore those things. And the work you do, right, is difficult and it's hard to keep a full battery all the time. But there are things that we know help us with that. So connection and validation. So taking the time out to connect with your colleagues, but also taking the time out to connect with people who have nothing to do with law, being in spaces that are validating and seeking those spaces out, tying your work as much as possible and being intentional about doing so to your purpose and to the ideals that led you to go into the field in the first place. Sleep sounds really simple. We can all take it for granted, but it helps with literally everything. And I find that often folks, kind of know this, but they haven't made a decision to protect their sleep. And that may mean the phone is on airplane mode at 10 o'clock and across the room. But whatever that looks like for you, really seeing your sleep as a key part of preserving your mental health for this really tough work that you do. Movement has also been shown to be protective. And in some studies, even for people with things like mild depression, to be something that helps to treat the depression. And I put movement instead of exercise because sometimes you say exercise and people start rolling their eyes. But really, just getting your body moving and going. And it's really less about what you're doing or whether you're doing burpees or high intensity interval runs up a hill, right? But is it something that you're doing consistently and that you're able to commit to doing? Support, so whether that support is informal, peer support, seeking out the support of those you direct report to, but that also may look like engaging mental health professionals, and then diet. So your brain is an organ, your organs need to be fed, your brain is no different. How it functions will be impacted by what you're fueling it with. So being mindful of that as well. And so as someone who has been a mental health professional for a while now, and taking care of a lot of really smart, high achieving folks, what I found is that they often have a sense of what works for them, right? Because the best plan for optimal mental health is not the same for everybody. It's very individualized, right? But most people on some level know what works for them and what doesn't. They know what they enjoy and what they don't. They know they need 7 hours of sleep or they need 9, right? And so my guess is that a lot of you already know. The bigger question is, have you decided, right? Have you decided that I'm going to commit to practices that improve my chance for mental well-being, and I'm going to protect the things that I'm doing that are probably helping to preserve me even now. So there's an adage, if you fail to plan, you are planning to fail. And so as you're considering this, I hope it's not just, oh yeah, it would be nice to start working out 2 times a week, right? But that you have SMART goals, so that they're specific, measurable goals that you're able to put into place, that there's accountability. So you're telling somebody about this new health promoting activity you're engaging in, that you're blocking off the time to do it, and then setting boundaries and keeping them. So when might it make sense to seek professional help? So sometimes you do the coping, right? You're doing all the things and you're still not feeling quite like yourself. Or sometimes you may not even have the energy to do all the things. So maybe you used to be a runner, but you don't feel like running anymore. And that was something that really helped before. On this continuum between mental health and illness, there is a part of this that does warrant enlisting the help of people who do this for a living. If the symptoms are starting to get in the way of your work performance, but again, that may come last. If they're starting to make it more difficult for you in your relationships, if they're causing you a lot of distress. So even if on the outside things look okay, if on the inside it's requiring extraordinary effort for you to get through the day, then that's a flag that it's time to call someone or email someone. And then certainly if there are thoughts of hopelessness, worthlessness, or suicidality, at that point it is beyond burnout, it is beyond STS. This is something where you want to have all the help you can in addressing it. And so the players, just briefly, so therapy can be from counselors, psychologists, or psychiatrists. Coaching can be a bit of a all comers. There are some credentials that may be required, but they may not, and often do not have expertise when it comes to actually treating mental illness. So if you are in the part of this continuum where the impairment, the extraordinary effort, the suicidality is, a coach would not be appropriate. This is a part where you would need a licensed clinician. Medication, most psychiatric medications are actually prescribed by primary care providers. In that context, medications can be used in a way that is helpful for people, but you don't have the same amount of time that they're able to dedicate toward the assessment or toward follow-up. So if you start with medications there and things aren't progressing as you would like, it's a time to think about working with a psychiatrist. If you want to make sure you have time to give the person who is writing the prescription context or more full context about what's going on in your life, then going right to a psychiatrist can make sense and may be the preferred option. You also have nurse practitioners who may prescribe medications. If you're working with a nurse practitioner, I would encourage you to make sure that it is one who is actually trained in the mental health field. So you have primary care nurse practitioners and you have mental health nurse practitioners. And in a lot of places, folks who do not have that psychiatric expertise are prescribing medications, and sometimes patients aren't aware of that. And so this is an opportunity, right, to look forward, to look inward, and to look back, and to also appreciate and maybe add to the list of things that are protecting you as you do the very important yet very challenging work that you do. Gabriel Garcia Marquez said, "It is not true that people stop pursuing dreams because they grow old. They grow old because they stop pursuing dreams." So it's not just about the things that are stressing you, right? It's not just about how hard the things in front of you are, but there's something that we all have to try to hold on to, which is this idea of what we're working toward. The ideal, that inspires us, and finding ways to keep that front and center and connecting with that on a regular basis. And I will end the prepared comments with a quote from Audre Lorde, because why not? She said, "Caring for myself is not self-indulgence, it is self-preservation, and that is an act of political warfare." And the world needs you well, and you matter, not just your work, but you. And so with this, we'll open it up for discussion or questions or comments.
So Dr. Vinson, we do have one question here. The attendee writes, "Can you recommend any specific articles or books you or your colleagues have written on these important subjects, which may be of interest and benefit to our viewers?"
Man, articles or books? I think that there is a there aren't specific ones, and I'll tell you why. Because so much of who people are has to do with different aspects of their identity, right? And so while Brene Brown may be somebody who a lot of folks relate to, there are some people who will read her work and see that there's a certain privilege she has that informs how she writes about things. So I wouldn't want to give a kind of a blanket recommendation necessarily. But the things that I did cover, right, are all based in a body of work, right? So there wasn't a single study about exercise and well-being or sleep and well-being. There are things that have been, well characterized over years, over multiple different studies. I can tell you personally, there's a book called When, make sure I'm telling you guys right. The Scientific Secrets of Perfect Timing by Daniel Pink that I found really helpful. But yeah, it's one of those things where I would encourage you to talk to people in your circle and see what they found helpful, because I think that's going to be things that are more relevant for you probably.
Very good, thank you. Somebody else wrote, they believe you mentioned The Body Keeps the Score by Dr. Van der Kolk. Did you happen to mention that one?
Yeah, well, it's I think it is a helpful book. I did kind of use that turn of phrase. But yeah, that book I think is helpful for people really to understand more about the body brain interface, because there is a way that we can take that for granted sometimes and not appreciate it. So that is one that is very popular, has been around for years, and that definitely can be helpful. When it comes to just learning more about trauma generally and how it may impact your patients, of course, Trauma and Recovery is another classic book. It's less about kind of the care of the lawyer, but could help you understand just stress and trauma better.
Excellent, thank you. And we just had someone else comment that they thought your presentation was wonderful and a very important topic to talk about in the profession, and I agree. So thank you so much. So now we will have our Vice Chair, L.A. Perkins of the Mental Health and Wellness Committee. She's going to jump on and share a few words about the resources that we have available to Florida Bar members. Hi, L.A. Hi, L.A. How are you?
Hi, Jamie. Thank you. And I just want to say thank you to Dr. Vinson for this amazing presentation. And on the heels of her terrific presentation, I'm delighted to share some very important bar benefits that are available to all Florida attorneys as well that are members of the Florida Bar, as well as Florida registered paralegals. And that is the Florida Lawyers Helpline. This is an incredible benefit that we have, where each of us has 5 free counseling sessions each year. And it is provided through a third party called CorpCare, which is totally independent from the Florida Bar. And I can personally vouch for that. I've seen the reports that are generated, and there is no information on who uses the service, only that it was used, and some very basic information that doesn't identify anyone. So it's 100% confidential. It's available 24/7. And you can access it through texting. You can call in, you can have sessions through video chat as well. I'll share my screen in a second. In addition to the therapy sessions that are available, the helpline also provides referrals for work-life services. For example, career coaching, childcare consultations, caregiver support, nutrition advice, and pregnancy support. I don't know if Jamie if she can drop into the chat just the information of the phone numbers for the service, but it is 833-FL1 WELL, WELL, and the number itself is 833-351-9355. And I see we have a couple of minutes, so I am going to share my screen. So you can see what it looks like, and you can access the screen through it's floridabar.org/helpline/. Encourage everyone to make their health a priority, and do not hesitate to use this wonderful service. And please, please, please share with your colleagues, our colleagues, and if I can answer any questions, please don't hesitate to reach out to me as well. Thanks so much.
Thank you. Oh, sorry. Thank
I
you
was
so
just going to say, turning it back over to you. I'm sorry.
Yeah.
Over you.
Thank you. Thank you for sharing that. And thank you again, Dr. Vinson, and of course, to our Vice Chair, L.A. Perkins, and thank you all for attending today's webinar. I'm going to go ahead and share my last screen so you can see the course number and credits. So the course number for today's webinar is 8177. This webinar has been approved by the Florida Bar Continuing Legal Education Department for 1 hour of General CLE credit, including 1 hour of mental health and wellness CLE credit. Please self-report this course in the member portal. You will receive an email tomorrow via Zoom outlining this information. This concludes today's webinar. Thank you, everyone.